Hello everyone, welcome back to the channel. So today we are going to discuss about our headache or headaches. So I'm going to break it down for you from what are headaches, who are most likely to get headaches, the most common causes of headaches, and then the different types of headaches and how to manage them, when to worry and how to effectively manage headaches. So let's start with the definition. A headache is a pain or a discomfort in your head, scalp, and the neck. So a headache can be a dull, sharp, or even consistent pain which lasts from minutes to days, and it is divided into two categories, that is the primary and the secondary headache, which we are going to discuss later on. So who are most likely to get headache? As I already mentioned, that most of us have already experienced the headache before, and it's not a new thing, but there are specific groups that are more at risk of getting the headache than others. And my number one point is, of course, people who undergo chronic stress. These ones risk getting tension headache, and of course women, because of the hormonal fluctuations. So women who undergo menstruation, pregnancy, or menopause, because of the fluctuating levels of the estrogen, they risk getting headache. Then of course family history, genetics play a big role in headache too, especially when it comes to the migraines. And then of course the lifestyle, people who have poor hydration skills, people who are not taking in enough water, people who have poor sleeping patterns, so you don't get enough sleep. We normally encourage 7 to 9 hours. So if you're not getting that, you risk getting a headache. And even skipping meals, also those ones are at a risk of getting the headache. And then lastly, people who have chronic conditions, for example, hypertension and sinus infections, these ones risk getting secondary headache. So when we talk about the common causes of headaches, these points are kind of familiar or similar to the points that I've already mentioned in who are more likely to get the headache. So points like stress, dehydration, because the reduced fluids in the body reduce the oxygen supply to the brain, and then of course poor posture. So if you have any strain onto your neck or the head muscles, these ones can cause tension headache. And then of course dietary factors, people who enjoy a lot of caffeine, alcohol, these ones can trigger migraine headaches. I already talked about hormone, especially in women. The hormonal fluctuations, especially in the estrogen, can lead to headache in the women. And then I already talked about sleep issues. So sleep issues, people who do not have enough sleep, or even those ones even who oversleep. Sometimes you can wake up and you just have a headache. And then lastly, environmental factors, the very bright lights, loud music or sound, and then strong odors. I can talk about perfumes. You've heard some people say, I can't manage a strong perfume, I get a headache. So also those ones can cause a headache, and those are some of the common causes of headache in people. If you have any more, you can drop them in the comment section. Now let us talk about the different types of headache. We have two, which are the primary and the secondary. A primary headache is a headache that is not caused by any underlying or any medical condition or external factor. So here the main problem is the headache itself. It is not a symptom of any medical condition. I hope we are getting something here. Here your only problem is the headache. It is not caused by any other disease that you may be having. So that is the primary headache. And examples of the primary headache, we have the tension headache, the migraines, and the cluster headache. So let us start with the tension headache. So the tension headaches are the most common headaches that normally we get. And this one is described as a dull and a tight pressure around your head. So it is caused by stress, poor posture, eye strain, and muscle tension. And the treatment is simple analgesics or over-the-counter painkillers like Panadol or paracetamol, ibuprofen, and then of course relaxation. Relaxation, I mean, do some meditation, do some yoga, have enough sleep. And then because it's also caused by poor posture, make sure that you're looking at the way you're sitting, the way that you sleep. Sometimes I had a friend, a roommate, who used to complain of headache because the pillow was too high for her. So there used to be a lot of tension on her neck, and she would always wake up with a headache. So one time I was like, why don't you remove the pillow? And she used to sleep much, much better. So sometimes look at the posture. Sometimes it is a sleeping posture, sometimes it is the sitting posture. So look into those things. And then, of course, lastly, take breaks in between the prolonged activities. So if you're working maybe on your computer the whole day, that is your job, we cannot take that away from you. Make sure that at least for 2 minutes, 3 minutes, get up, just go outside and look around before you go back and again sit for the next 6 hours or 5 hours or 4 hours on that computer or laptop. Just get these breaks between your prolonged activities. This will help a lot if you're suffering from the tension headache. Then we go to migraines or the migraine headache. This is a reoccurring headache that is characterized by severe throbbing or consistent pain on one side of the head. So it is also accompanied by nausea, sensitivity to light and sound. Mainly it is more of visual disturbance. So it is caused by genetic predisposition. I already mentioned this in who are more likely to. If it runs in your family, you are more likely to get the migraine headache. And then, of course, stress, a lot of caffeine and alcohol, then triggers from hormonal changes also bring about the migraines. And then, when it comes to the treatment, medications like the triptans are used to treat migraines and cluster headaches. So they can use that. And then, of course, if you have the nausea, they can give you the anti-nausea drugs. Good sleeping habits, good eating habits, make sure that you reduce your caffeine and alcohol intake. Then also simple analgesics like Panadol or paracetamol, ibuprofen can also help you with this. So lastly, we cover the cluster headache. So the cluster headache is an intense and severe headache that normally occur in cycles or clusters, often around one eye or one side of the head, and this can take weeks to months. So the exact cause of the cluster headache is not known, but it is linked to the hypothalamus irregularities. And the treatment is normally oxygen therapy, prescription medication like the calcium channel blockers. These ones will be got for you by your healthcare provider. And then also pain medication that targets the nerves. So that is all from the cluster headache and generally from the primary headache. I hope that you've learned something from that. So let us go into the secondary headache. So the secondary headaches are the headaches that result from medical conditions or external factors. So that is a key differentiator from the primary headaches. However, the secondary headaches are caused by medical condition, underlying medical conditions. So for example, if you have hypertension, the hypertension is the one that is causing that particular headache. So with the secondary headache, the condition behind it, a medical condition or any other external factors, is the one that is causing this headache. So let us look at some of the examples that may be under the secondary headache. Number one is the sinus headache. So when you talk about the sinus headache, definitely there is pain and pressure in the forehead, the cheeks and the nose caused by the inflamed sinus. And then the causes of the sinus headache is of course the sinus infection. We have the allergies and the nasal congestion. And then when we come to the treatment of this headache, definitely we have the antibiotics for the bacterial sinus infections. Then we have the simple analgesics like the paracetamol. And then definitely we have the saline nasal sprays. You've seen people spray them into their nose to open it up. Lastly, the use of hot steams. These ones can help to open the blocked nasal passages, but do not overdo it. I've seen some people, just because they even just have flu, they want to do it. Only use it when you have blocked nasal passages, and they are really, really effective. So we can also talk about dehydration headaches. So dehydration headaches are caused by insufficient fluid levels in the body, and these ones are caused by poor hydration, excessive sweating and excessive vomiting. If you have ever been sick and you vomited so many times in a day, you have noticed that you got a significant headache. So that was caused because the body was losing electrolytes, was losing fluids. So that is the reason why you got that headache, and that headache is called dehydration headache. And the treatment for this is simple: rehydration with water. Rehydrate, drink water. That is the only solution to the dehydration headaches. And then also prevent dehydration triggers like caffeine and alcohol. If you're taking them, try to minimize. Do not do it, do not overdo it, because when you overdo it, then you're going to get dehydration headache. We also have medication overuse headache, and these are also called rebound headache, and they're caused by overuse of painkillers. So it is caused by overuse of medications like the aspirin, the ibuprofen for more than 10 to 15 days per month. So the treatment to this is definitely just gradual removal of a patient or a person from these painkillers. But this is done under medical guidelines. So you don't just wake up in the morning and you're like, I want to stop using painkillers, and you stop. No, this is under medical guidelines so that it can help the person. And also use of preventive measures. So instead of using painkillers for even the smallest things, try sleeping well, improving on your eating habits, avoiding stress, try relaxation methods, and then also reduce on your caffeine and alcohol intake. And then we also have headaches that are brought about due to infection. So infections, we can talk about meningitis, encephalitis, or even severe flu. This headache is caused because of the inflammation of the brain and its surrounding areas. So when we talk about the treatment, we're going to talk about the antibiotics, the antiviral, or any other prescribed drug that is going to be used during that time. Also, the pain management medication used alongside the prescribed medication. Lastly, under secondary headaches, we can talk about headaches that are related to trauma. So headaches that are caused by head injuries and concussion. They are caused by the swelling, pressure changes, and even direct pressure to the brain. So treatment is normally resting and avoid stressful activities, pain relievers and analgesics prescribed by your healthcare provider, and monitoring for signs of severe complications, for example, confusion and worsening symptoms. So I wanted us to also go through a hangover headache. So a hangover headache is not under primary or secondary headaches, but I think it may fall under dehydration headache, and you may agree after my explanation. A hangover headache is basically due to dehydration because the ethanol or the alcohol increases the amount of salt or water that the body loses, and this brings about the chemical imbalances and dehydration. And this one can last for a few hours to a whole day, and the best medication here is rehydration. Just try taking some spotty drinks with electrolytes, just eat some eggs, bananas, and maybe put a cold compress on your head, close your eyes, and just have some sleep. That is all. You will be fine after that. So when should you worry about a headache? Worry about a headache if it is sudden and severe. There is a headache after a head injury. A headache that causes visual impairment or loss should be taken very, very seriously. A headache that is worsening over time, and then also a headache that is causing symptoms like fever, stiffness, or confusion, please go and see your healthcare provider immediately. This is not just a usual headache. Here are some of the tips that are going to help you effectively manage a headache. Number one is hydration. Stay hydrated. With men taking 3.7 liters and women taking 2.7 liters of water daily, I would love to encourage people to have like a drinking culture. Drink water, stay hydrated. Sometimes I would say it is easier said than done, but there are these bottles that I've seen that have like encouraging notes of them. Drink me at this time. I hear you've gone to this level, stuff like that. You can get those bottles, they're actually helpful. You end up taking 2 liters because I've seen some are 2 liters, 1.5, which is not a bad thing. So I've developed a culture of drinking water, and now I enjoy taking water. Secondly, have good sleeping pattern. I tell people it's around 7 to 9 hours, but then it also depends on someone's work. Some people even sleep for 3 hours, 2 hours. But then I would say have a good sleeping pattern that is going to help you not to have these headaches. Limit stress, reduce on your caffeine and alcohol intake, have a balanced diet, practice relaxation techniques like yoga, meditation, read a book, and then lastly, use over-the-counter drugs like paracetamol. These ones we always tell people you can use them, but I'm against self-medication, and that is why I say use these drugs responsibly. Remember, headaches are something that most of us deal with, but understanding the cause and treatment can make a significant difference. Remember that if your headache is severe and frequent, don't hesitate to go and see your healthcare provider. If you found this video helpful, do not forget to give it a thumbs up and share it with whoever might find it beneficial. Don't forget to subscribe to the channel so that you can get more health related content. Let me know in the comment section how you deal with your headache and if you have any tips to share. Thank you for watching and see you in our next discussion.